A day in the life of a PCA, patient care associate, depends on what floor you're on. So there's 4 floors in the hospital. There's adult mental health, CAU, which is child adolescent, IED, which is adult eating disorder, and then CAED, which is child adolescent eating disorder. Sometimes they different things you're gonna do as a PCA, but for a roundabout, you are gonna be on your feet quite a bit. You are rounding on the patients, whether they're adults or children. You will be rounding on them for 15 minutes at a time. When you're rounding, we do have set iPads that say rounding on them. It's very easy. You'll see the patient on the iPad and they have, it'll light up if you're close enough to them, and then you'll tap on it and you'll tell them where they are and if they're awake or sleeping. So if they're in a consult room with a doctor or a behavioral specialist or another tech, if they're having a hard time, you're rounding on them to know where exactly they are and what exactly they're doing. But you are on your feet a lot. I wouldn't say that you're sitting a lot. You do get in your steps, so that's a good thing. I'm very go, go, go person, so it works really well for me, and we're hands-on with everything on the floor. We're never usually behind a desk or charting unless it's that they go to group or they're outside and then we're charting our meal flows or we're charting something. Other than that, we are with the patients all the time. Another part of it is you are putting out all of their meals. You're writing all of their meals out, of the percentages that they eat. You're charting everything that they eat, everything they have for breakfast, lunch, dinner, and then they do get 2 snacks throughout the day.
We're gonna just do your vitals.
You will take vitals. You can have detoxers. You gotta make sure they're okay. With eating disorder, they're obviously malnourished. And so you wanna make sure that their vitals are okay and they don't have to be sent out somewhere. When you get an admission, you will go with the patient and another nurse, and you will help with the gown check. And we have them put the gown on and we check their clothing to make sure they're not bringing in anything sharp. You can't take anything at work personal. You need to be that person that they can lean on. And that's what part of your job is being that supportive person. I've always noticed seeing people come in at their worst and leaving at their best it's really rewarding knowing you had even a little part of help with that. You're gonna have rough days, but you're also gonna have really good days, and that's where I was saying personal care. You have to really take care of yourself, knowing you're going to work to take care of somebody else. Working in mental health is amazing, and everyone that I work with is very good with mental health and understanding mental health. It's just so rewarding. It makes me feel so good as a person. I might be helping them, but they help me too. And so it's so rewarding.